It's not often you get a kiss from your physical therapist, but Clyde Norton doesn't mind. In fact, he counts on it. His new best friends, Walker and Casey, are part of a special breed of canine known as therapy dogs. They've been specially trained to enter into a healthcare setting and help patients with their rehabilitation. For Clyde, these furry physicians couldn't have come along at a better time. Last December, Clyde not only had to undergo hip replacement surgery, but just 3 weeks later, he had a stroke. As a result, he needed speech therapy to regain his communication skills.
Paper. You did it. Good.
First and foremost, in his mind, he would focus on the day that the dogs would be scheduled to come. And that was a very good day for him to come to therapy, because that was an important part of his therapy.
These canine comforters fill that important role by giving Clyde just what he needs to accomplish his goals. A distraction from the difficulty, lots of love, and the motivation to keep going.
He works hard because he knows that if he works hard, he gets to come back here 3 days a week, and he gets to see one of his favorite things, and that's the therapy dogs, Walker and Casey. And that's good. That would inspire anyone.
But these therapy dogs are doing so much more than just lifting spirits and providing emotional support. In many cases, they're providing physical support as well.
It's tough to tell who's more excited about this visit, Casey or 2-year-old Hannah. Hannah was diagnosed at birth with cortical dysplasia. It caused her to have a seizure disorder. Correcting it required brain surgery.
The resection of her brain in that bad portion, where the cortical dysplasia was, relieved the seizure disorder. As a result of the surgery, though, she suffers from left-sided weakness. She can't use her left arm and hand very well.
Training a 2-year-old to use muscles that don't want to function can be a challenge. That's where the therapy dogs come in. Hannah gets a workout, but it doesn't seem like work.
Hey, both hands. Remember to use this hand, too.
If they're doing therapy with them, it seems like they give a little extra energy, a little extra push to work with the dogs.
I love that she is doing things that she might not otherwise do with a therapist, and certainly not with me, getting down on her stomach the way the dog did to imitate the dog, and prop herself up on her left arm. She hates to get on her stomach, but because the dog did, she was willing to do it and prop herself up.
Show Casey how to do a push-up, Hannah. Push. Oh, push. Push with this one. Oh, there you go. Yay. Good job.
Using her left arm, she's willing to pet the dog with her left arm.
There you go. Good job.
Even time out for a treat turns into time for a treatment.
Look at your hand. It's big and wide. Ready? Here it goes. Did she get it? She got a treat, didn't she?
All of this exercise has Hannah dog-tired. But there's no lying down on the job for these doggy doctors. Time to make the rounds. They still have plenty of patients to see.
They do go around and just visit with patients. If they're up on the tables, depending on what kind of activity they're doing, they may be working on strengthening of range of motion, and they can be used to help with patients' balance, if they're standing and throwing balls and bringing balls back. Sometimes they'll have them do some of the grooming of the dogs, and that may help with strengthening a range of motion.
When you have good therapists of all kinds, and that includes the dog therapy, you have this determination to get well again. It takes all of this therapy to cure these patients.
Whether providing a listening ear for someone working on their power of speech,
good boy, yeah, good boy,
motivating a patient to do just a little more, or helping to take away some of the pain, therapy dogs are offering something immeasurable to the world of healthcare.
Once you pet and once you love those dogs, they love you back. I've seen patients here that had frowns on their faces, and the dogs would come in automatically, a smile. This has been such an inspirational thing. It's a good feeling for me, and it's very good for the patient.
Animals seem to help people want to do more because they're just wonderful.
Night-night. Night-night. See you in the morning.
For Smart Medicine, I'm Rod Starnes.
Joining me now is Mary Earhart from Mid-South Therapy Dogs. Mary, thanks so much for joining us.
My pleasure, Kim.
Oftentimes when we think of animal-assisted situations, we think about seeing eye dogs. Tell me how a therapy dog is different from a service dog.
That's a good question, Kim. Therapy dogs shouldn't be confused with service dogs because service dogs perform a particular task for a person that has a disability. Seeing eye dogs are a good example of this. I think we're all familiar with them. The service dogs also, by law, are allowed to accompany the people wherever they go. Therapy dogs, on the other hand, like Walker, are brought into established therapeutic facilities, and they assist a therapist with a particular task.
Now, therapy dogs can help in alleviating stress, and from what I understand, therapy dogs were used in 9/11 to really help the families. Tell me how that worked.
They're unconditional love. They never question, and they're always available for the person just to hug. And sometimes in a bad situation, that's the only comfort somebody can get, and they always make you smile.
I understand that therapy dogs can actually help children learn how to read. How does that help?
I know, that's a little bit strange, but this program started in January of 2000 by a group in Salt Lake City called Intermountain Therapy Animals. They placed dogs in classrooms with children as reading companions. Reading to a dog is a lot less intimidating than reading to a person, and if you put that in a fun environment, amazing things happened. And one of the things that happened is that the children's overall self-confidence for reading improved. They had better self-esteem, they participated more in school, and they were absent less.
If I